remember the day when you had practices that a physician had 3 prescription pads on their desk, and those were the 3 drugs that they prescribed, and they just signed and handed one of 3 to you. It was just here, take and go.
We all bear the responsibility that prescription information is clean, structured, and meets appropriate standards.
One of the ways that electronic prescribing can be improved is having a consistent implementation of some of the standards, so that there isn't that element of interpretation that might not translate well between all of the partners.
For example, if the physician writes a prescription for 20 tablets and in the note says dispense 60, right? So we're talking about ways to reduce the chance of that happening.
When we bring the representation from EHRs and pharmacies and the health systems and the provider together, and they talk about what is it that's preventing the prescription from going through fully accurately, then they can come to some really great results.
So we have defined as an organization, working with our partners on the pharmacy side and the payer side and the EHR world, 35 different criteria that constitute highly accurate prescriptions. We then built a tool named Sentinel that measures accuracy of each and every script against those criteria, and then we give reports back to the EHRs, to the pharmacists, etc. The idea here is to ensure that these scripts are as accurate as possible. Why does this matter? Why do we care? Because so far, what we've identified and been able to correct eliminates 50 million unnecessary transactions per month between pharmacists and physicians. There are 50 million less phone calls, faxes, etc. because of what we're doing here. It makes a huge difference.
The trending reports that have been provided to us to, number one, give us visibility on how we're doing. It's our report card on data integrity. And then secondly, based on the expectations that Surescripts has set for your entire client base and partner base, it's also important for us to understand how we map up against that. And so I think all those things go into ensuring that we are having and providing the most quality transaction to the network.
We're making a massive investment internally and into the market to drive the next generation of script accuracy. And I'm really excited about, that's our Critical Performance Improvements Program, our CPI initiative.
CPI has provided a really valuable opportunity for all of us to work together to gain those different viewpoints and strive towards patient safety.
Having patient accuracy, having the information that is important to that prescription itself, including the name, strength, dose, the actual SIG and instructions, all those things that sometimes have a propensity for errors. And so having the integrity now across the network is extremely important and adds to the value and more importantly to the patient safety effect of that particular patient care.